Okay, so first things, what did I do? Um, First things first, I found like this paper,
Mm-hmm.
6 minute walk test as a measure of disease progression, fatigability in a cohort of individuals with RY, R1 related myopathies. Is this the one that you were referring to? Because I couldn't find one like in 2017, but this one is 2018, so I thought this was
Okay.
what you were talking about. So this is what I used, and I made the adjustments on how the test is conducted. Um,
Mm-hmm.
I kind of kept this the same because I didn't really see anything different. So the changes I made was participants walk as far as possible for 6 minutes on a flat, straight course with rest allowed if needed. Walking speed, and changes in speed over time are recorded. And this evaluates endurance, fatigability, and functional capacity by comparing performance at the start and end of the test.
Mm-hmm.
And I kind of just tried to make some edits to this to make it more general to all functional tests.
Mm-hmm.
Um, but yeah, it's kind of this was supposed to be deleted. It's kind of the same. I haven't made too many changes because I felt like in general it was already kind of like it wasn't like test specific. It could like the same reasons could be used for any of the tests, so I kind of kept that the same.
Okay.
And those were the only changes that I made for like this section, the overview of functional assessment tools.
Okay.
And then what else did I do?
Did you change the sit to stand like we had discussed?
Did I do that? Sit to stand, see that's what the changes I made were. I took away the because what we said was the what did we say was too repetitive? I think we said
That's
this
right.
was too repetitive. I can't
Yeah.
remember exactly.
Yeah.
But yeah, I made some changes, tried to that's what I was kind of like struggling on. Like, what are like other reasons? Because I know we talked about making it more like patient centric, but that was just like some trouble I was having in like changing that.
Okay, go back. Look at the
Yeah.
structure, what you have done for sit to
This one,
6 minute walk test, right? 6 minute walk test. See, you have told purpose and relevance to myositis.
mhm,
Here, what are the key factors? Endurance, aerobic capacity, and those are the things that are describing your muscle function.
mhm,
See, your common pattern is what? You are talking about the fact that this is used to assess muscle function. In muscle function, what are you assessing? Okay, that is aerobic capacity and endurance.
mhm.
There is one more, I believe, right? There's supposed to be one more thing in 6 minute walk test.
What's it? Aerobic capacity,
Fatigue.
endurance, I think.
Those are
Oh,
not two different points.
okay.
See,
Yeah, those are the same points, yeah.
yes. So it's just one point.
Hmm.
So I would say focus on that
Hmm.
with respect to, hey, these are the things that the test measures. That is relevant for me rather than having, like long sentences or longer points.
Yeah.
Make sense? Then you go into how is the test conducted. See here, you look at the structure, right? First one you're saying, what is the test measuring? That's what you need to know. Once you know what it is measuring, then you're asking how is it performed, right? And then I would say, how is it currently performed, right? Now you will have the opportunity to do what over here? Suggest how it can be performed,
Hmm.
right? That would be your third point.
Okay.
Make sense? So what
Yeah.
is the test? How is it currently performed? How it can be performed? When it comes to how it can be performed, that's where you put references to other papers, say stating how they have done it.
Hmm.
Make sense? So
Yeah.
that's what you do for the 6 minute walk test.
All right.
And we said that barriers to modernization that we are keeping as another section, and because that's going to be the same for everything.
Hmm.
So that's the thing that we wanted to move.
Yeah.
Okay. Now tell me, move to sit to stand and tell me the same structure.
Yes, this one is purpose relevance to myositis, how the test is conducted. And this one I had clinical significance, but I think I might just delete or like edit this part because it does seem a little repetitive.
Correct.
It could just this part could just be added or integrated into purpose and relevance.
Yes. And I would just say, how is the test currently conducted and what is the potential, right? So
Yeah.
that is the thing that you need to
Hmm.
state. Just those 3 points. See, when I say an outline, right, this is
Hmm.
not what I expect. I don't expect you to write big sentences,
Hmm.
right? I want you to tell me the high level things of what you're thinking.
Yeah.
And then once we get that right, then we go into the nitty-gritties.
Hmm.
Make sense?
Yeah.
So that's something. And I asked you to do something else, right?
Um, I think 6 minute walk test. I looked over the paper, made the adjustments.
Mhm.
I continued editing. I edited the discussion and then I edited the actual like writing part of the, or I added
Correct.
some more to it.
Yes.
Let
Can we move
me,
to discussion?
yeah, let me pull that. Okay, so what I did was I just like I combined the first or what is it? Yeah, the first and second para. So theme, I kept this sentence the same. Functional test like STS, or I'll probably just make a functional test.
Correct.
Are simple and can be conducted at home with minimal instruction, which can streamline patient monitoring. Shifting the assessments to a home setting can promote active participation, reinforcing accountability, improving long-term income, should have evidence. I still need to find like something that like outright shows the correlation.
Hmm.
And then I split the advanced technology and accessibility portion. So
Hmm.
here, advanced technology, rapid advancements in software and mobile health platforms enable accurate automated assessment, making home-based monitoring possible. AI and video analysis now allow for real-time error detection and movement corrections, allowing for precise results even without clinician supervision. And then for
Hmm.
accessibility, I wrote that I kind of just kept this point the same about, COVID encouraging people to use their phones more. And I also added that software-based functional tests are cost effective and scalable, allowing diverse populations to access routine assessments without traveling to clinics. And then future directions are the same.
Okay.
And
Yeah,
those are
that's
the edits
good.
I made to the discussion.
Yeah, that's good. This is really nice. I liked it. And I would encourage you to think about adding one extra point to each, the three
Mhm.
paragraphs. And what would that point be?
Okay.
Okay, that's what I would do. And yeah, it's good. And advancing technology, I would say, when it comes to your first point, right? You need
Mhm.
to see, people went from laptops to mobile phones,
Yeah.
and many people have mobile phones,
Mhm.
right? So it's not that software has become better, it's the infrastructure that has gotten better.
Yeah. Okay.
Right? So when you say advancing technology, everyone has access to smartphones. Most people have
Mhm.
access to smartphones. That is something that I would, state. And that's a very good point. And then you say that software, because these smartphones are so widely available, the software is you can run capable software on these devices. And when you say capable software, you say that video analysis software can be run effectively on these devices.
Okay.
Make sense?
Yeah.
Because even on Zoom or even like when you do like WhatsApp call or something like that, right? You do have an aspect where the person is able to, like, you can blur the background, right?
Mhm.
And even when you take a Google picture, you can still blur the background.
Yeah.
So that is happening on your device.
Mhm.
So they are capable. That's what I would say.
Yeah.
Yep. Go ahead.
And then Let me pull up. So introduction, I kind of cut it down, the beginning part. I cut that down and I started going into um like gaps, limitations, and then started writing about like the what was it? What was it like labeled in the introduction? And the role of software in modernization of clinical assessments. And I left like some room for me to talk about the osteoarthritis use case because it was kind of like I was going to use that to like compare and justify why we think this is possible in sit to stand or in myositis, sorry.
Hmm. So that should not be in that section of the Indian. So I'm so sorry. Can you go back to the outline?
Yeah.
Was that where we had discussed that we are going to put it?
It was also like somewhere else. I think maybe in here, software integration clinical tools.
Yes.
I think it was, or maybe, or probably in methodology. It was either here and here. This is like the only place where I wrote that.
Yeah. Because see, that should not be your major thing, right?
Okay.
So I would not focus too much on that. That
Okay.
you should focus. See, that I made you read that paper was because I wanted you to understand what was happening. Like even
hmm
with the 6 minute walk test, right? You need to read those paper to understand what the test is,
hmm
right? And then how is it different in myositis? Makes sense?
hmm
So, like how we had the 5 count to be different in this. Now there is like 6 minute walk test and 10 minute walk test or 10 feet walk test or blah blah blah. So that is something that you need to talk about.
hmm
And why they have given rationale in the 2017 IMAX core set committee paper, they would have told you about the 6 minute walk test.
Yeah.
And there is already technology. That's what I thought you would show me as well. That, hey,
hmm
in 6 minute walk test, there's already technology that will use your phone's GPS to tag the distance that you have traveled.
Yeah.
So that is what I was looking for when it came to the 6 minute walk test, right? And those are the things that you have to highlight. Need not
hmm
be only when it comes to myositis, right? Okay, go back to the 6 minute walk test. Let me describe it to you. In the right now, what have you done? You have told how is it relevant to myositis? Number
hmm
one. Number two, you have told how is the test currently conducted, right? And then number three, what were you going to say?
uh,
How can it be
y-
made better?
yeah.
What is the potential in it? Now, in this, you need to review. So think logically, right? We are trying to convey how are we modernizing the 6 minute walk test in myositis. 6 minute walk test has already been modernized for other diseases,
hmm
right? And if in myositis also you are measuring the same way, then all you say is implement what they have done over there, over here. That's it. For the sit to stand, there's a difference. So you have to validate it. But here it has already been validated.
Yeah.
You see what I'm trying to say?
hmm
And they already have a smartphone based thing and they already have validated it.
Okay.
Sounds good?
hmm
Yep. Next.
You want me to like read what I wrote for the intro? I'll just.
Yep.
Okay. So I wrote myositis.
Before you go,
Yeah.
Kushala, do you have any comments about the outline or anything?
Um, no, not really. I think yeah, like she doesn't have to use full sentences. She can just use like just keywords. That would
Yep.
reduce her work as well.
Yes. Got it. Cool. Go ahead. Start with the introduction.
Myositis is a group of inflammatory muscle diseases causing muscle weakness, fatigue, and impaired mobility. The progression of these conditions can vary, making it important to monitor muscle function over time. Functional tests are tools that play a vital role in assessing disease progression and treatment efficacy in myositis patients. These tests provide critical information regarding patient strength, endurance, balance, and fatigue levels. Traditional myositis assessment.
Hold.
Yep.
Strength, endurance, balance, and fatigue. So
Mhm.
all these we have mentioned in the paper, right?
Like before?
In the 6-minute walk test and the sit to stand, strength, endurance, balance, and
Yeah,
fatigue.
probably in the
We
wide
have.
open, I think. Yeah.
I made you read it
Mhm.
with 6-minute walk test. Yep. Go ahead.
Yeah.
So you have to put that as reference over there.
Put the test as references or references
Or
to
the IMAX paper, 2017 IMAX paper as reference.
Okay.
Every sentence that you state has to have a reference, right? So you should think about, see, very simple. Am I am I am I forming an opinion or am I stating a fact? If you are making a statement if you are stating a fact, progression can vary, blah, blah, blah. And it is important to see, look at the second statement. The progression of these conditions can vary, making it
Mhm.
important to monitor muscle function over time. Okay? Even if you don't put a reference over there, it is fine,
Mhm.
right? But if you say myositis is a group of IM which has fatigue and muscle weakness, fatigue, and impaired mobility, that you need to put a reference
Okay.
because that is a fact,
Mhm.
right? Then I would say functional tests are tools that play a vital role in assessing disease progression and treatment efficacy. These tests provide critical information regarding the patient's strength, endurance, balance, and fatigue levels. So you have said that twice, right?
Okay.
In
Yeah.
the first and your last para is the same.
Mhm.
So you should give something else, more new information, or remove the last para.
Okay.
Okay? Yep. Go ahead.
And then continuing, traditional myosite assessments rely on condition observation, making them time-consuming and dependent on in-person visits. This limits the frequency of evaluations, creating data gaps that can limit limit the tracking of subtle disease progression. Inconsistencies in clinical observation can further reduce accuracy, make as different clinicians may interpret results differently. These limitations make it challenging to gather comprehensive continuous data, restricting the ability to monitor myositis effectively over time. Software and technology can enable.
Hold. Show me the outline and tell me what the outline meant.
Um, yeah. This is second para.
Mm-hmm.
So yeah, I kind of just kept the simple time-consuming required direct clinician observation, data gaps due to irregular assessments. May not be able to
Hold.
capture fine details.
Yes, here. So you can actually split the thing browser into two. Can you
Mhm.
do that?
Yeah.
But you can show your outline as well as the paragraph.
Mhm.
Yep. Move it to the, yeah, that's good.
No, this should be like a pop-up.
Just take it to the side. It will pop up to the side. Yep, that's good. Move that a little bit. Yes. Now show the outline. Hmm. Now let's go one by one. What is your second para supposed to say? Talking
Gaps
about
in,
limitation.
yeah, limitations
That
and
is
yeah.
the theme.
Mhm.
Right. Here you have told about it is time consuming, requires direct clinical observation, and data gaps due to irregular assessment.
Mhm.
Okay. Now, let me tell you, that's what you want to convey.
Mhm.
Now, read what you have written.
Traditional modified assessments rely on clinician observation, making them time-consuming and dependent on in-person visits. This limits the frequency of evaluations, creating data gaps that can limit the tracking of subtle disease progression. Inconsistencies in clinical observation can further reduce accuracy as different clinicians may interpret the results differently. These limitations make it challenging to gather comprehensive
Hold,
and
hold.
continuous.
Yeah, hold.
Yeah.
So, that is supposed to be a limitation, right?
Mhm.
Now, go back to your outline.
Yeah. Um.
See, the things that you need to choose over here, you should be a little bit smart about it, right? There should not be a different interpretation at all. Now, you had a outline and you wrote something. Now, let me tell you what I am thinking, right? I would say traditional assessments mainly rely on clinical clinician observation, right? When you say that, it means that there is no other way of doing it, right?
Mhm.
And you're saying clinician observation is the ground truth, which is not really the case.
Mhm.
Because in other diseases, and there is like a monitoring system as well, where the patient can have a book and he can count the number of times he
Mhm.
stood and sat down.
Yeah.
So your statement is wrong,
Yeah.
right? So
Mhm.
that is also a traditional assessment, right?
Yeah.
Now, what I would say is it is time consuming and it requires clinician time. That's the main thing, right? It
Mhm.
requires clinician time. And
Mhm.
that has not been mentioned over here for you. See, think about it this way. If the clinician has to do a standard test, that is manual muscle testing, and in that manual muscle testing, I am assessing muscle strength. Anyways, why would I do the sit to stand?
To
I would
assess
not
muscle.
do it.
Oh, and
I would not do it.
okay.
What additional value does sit to stand have? Because if I am have to do like let's say if you are anemic, right? What are ways to know you're anemic? I can do a examination where I look at the, paleness in your eyes, hands, blah, blah, blah. Or I can ask you, when you're visiting me, I can ask you to do a hemoglobin test and come.
Mhm.
Now, which is better?
Mm,
Doing the
like,
hemoglobin test,
yeah,
right? If I have that hemoglobin test, what is the point of me touching?
there's no point.
No point, right? So that's why people are not doing the test.
Mhm.
Do you understand?
Yeah.
Now, the difference in that scenario and what I'm saying is when it comes to the test that we are trying to make the patient do, it has value. It has value, and we should relate that value to the fact that these tests don't make a lot of sense to be performed in the clinic, and they're better, and it's better that you do it them at home. That is the message that you want to drive through your paper, right?
Mhm.
So focus on time consuming and focus on the fact that there is a possibility that these patients don't get tested in the first place
Mhm.
because they might miss their visits. That is the theme, right? And that is what I am interpreting from your outline. Focus on time consuming and data gaps due to irregular assessment. Right. Now, how did you word it? You are like, this limits the frequency of evaluation.
Mhm.
So, no, making them time consuming and dependent on in-person visits. And
Mhm.
this limits the frequency of evaluation. That is wrong, right? If it is the standard of care, you have to evaluate.
Yeah.
Because it's not the standard of care, why should you evaluate? You haven't proved me that it is the standard of care.
Hmm.
So how do you say you are missing the, you know, data?
You can.
You can't,
Yeah.
right? So that's the difference, right? And
Hmm.
then when you see, that's one aspect, right? That's the theme. Next, you see what we had told, gaps of traditional assessment method. And this is very true. You may not capture this fine detail, and clinician observation can sometimes lead to inconsistencies or time constraints. See, that we are repeating. I kept that because I was fine with small detail.
Hmm.
And when it says inconsistencies, it is harder to prove, right? And I wanted to see if you'll get like a paper where they're saying that, there are papers I know. I know what those papers are. That's why I kept it over there. I was like, okay, let me see what you'll do.
Hmm.
Now let's read what you have written. Inconsistencies in clinical observation can further reduce accuracy as different clinicians may interpret results differently. These limitations make it challenging to gather comprehensive and continuous data, restricting the ability to monitor myositis effectively over time. See, this is a very wordy,
Hmm.
right? And you need to make it more clear. When you say, see, what I would recommend is take the outline, think about it, and think that, okay, what is something that is making absolute sense? Right? And when you come up with the answer saying that, okay, this is the only way it's going to make sense, and there should be no other interpretation, this is the
Hmm.
interpretation that this person has to take away. That is when you write. Okay. Now, does it mean that you have to go over 3 drafts, 4 drafts, 5 drafts? It's okay. It should be so clear. Does it
Hmm.
make sense?
Yeah.
And then you come back to your outline and say that, okay, can I remove some things which are not making sense?
Yeah.
Okay. So that's how you refine both your writing and your outline.
Okay.
Okay. So now that's what I would suggest you to make the
Mhm.
change in. Was it
Yes.
clear? Any doubts?
No, I was like writing all of it down. So,
Mm-hmm. That's good. Now let's go to the next one.
uh, software and technology can enable remote and automated functional tests, reducing the need for in-person evaluation. This allows for frequent patient-driven monitoring, capturing subtle changes in muscle function that traditional methods may miss. Tools like smartphone apps, video analysis, and wearables can provide continuous data outside clinical settings. And that's
Hmm.
where I got.
Okay. So what would you change over here?
I think I would probably maybe not focus on the, capturing subtle changes, maybe just more focus on there's not a, you don't have to do them in the clinic,
Mm-hmm.
and this software can enable people to do it at home, making it like not making it more efficient, not taking up as much of the clinician's time.
Yes, but you're not supposed to state that.
Yeah, I know.
That's what it should mean, but it's not
Yeah.
stated that way. Come to your outline.
Hmm.
Can you
Yeah.
scroll? Yeah, a little bit. Role of technology in allowing remote or automated functional testing, which can reduce the need for in-person evaluation. So I would paraphrase that and say that rising teleconsultation will create a need for remote monitoring of these functional changes, right? And then I would say that is how I would like to, word stuff. Then I would
Okay.
come back to say that, okay, this enables patient-driven, frequent, patient-driven assessment and frequent monitoring. Okay, more data points basically. And then you say that, okay, what is already out there, right? They can use smartphones, they can use like wearable devices. Those are the things that patients are already using for monitoring their
Yeah.
disease activity. So that is what I would, state.
Okay.
Okay. So that is something that you need to emphasize. Now, what I said was also not very clear. You have to go back and you need to think, like how I told you, think through the second paragraph. Same way, I want you to think through this paragraph as well.
Mhm.
And see, just because I'm saying doesn't mean it's right. No, you should also go and verify and, tell me that, hey, this is wrong or this is correct.
Mhm.
Make sense?
Yeah.
Kushala, do you have any comments or do you have any inputs?
Uh, no, not really. Like this is also like I'm new to this whatever this
Mm.
field is. So whatever you said does make sense. But yeah, like my point is, isn't that kind of like feeding everything to the reader? Like you're framing everything just to fit your point of view.
Yeah.
Shouldn't there be some objective way of like saying this whole thing? Like maybe say these are just some aspects. Like, are you mentioning anything about the benefits of actually going to the physician to perform these tests at least once in a while, somewhere in the
Um,
paper?
yeah, there is in the section on why these tests haven't been modernized yet. One of the like I'm gonna mention like one of the concerns is that if unless there's a trained professional, there may be like some potential for like the data to be or to not be like accurate.
Okay. Is this in the discussion part?
This was
Like,
let me show it. So it's like the whole section is called Overview of Clinically Validated Functional Assessment Tools. And then this is kind of going into like what the current like what functional tests
okay.
can be used in myositis. And then after like talking about what the functional tests are specifically, kind of go into why these tests like haven't been modernized yet and then why they can be. It's essentially like why like what is the potential and why should they be modernized and like put online.
Okay, I'm reading it. Yeah, okay. Uh, okay, fine. But yeah, like I was thinking, it just feels like it's you're making an argument. Is
Mhm.
that what a narrative review is supposed to do? Like, are you just making an argument for one side? Like, is that what it is supposed to be? I don't know. I'm asking you guys.
Yes. Yes. Because see, when it is systematic review, right, you have to present all points of views.
Okay.
And that is the reason why you have to follow a particular system, like whatever they have described. And when it is a narrative review, you're narrating one side of the story
Okay.
and you are using limited information, like limited papers, to narrate one side of a story. And the story that we are trying to narrate is, hey, why should you use software like video analysis, like video capture software in myositis, patient monitoring? That's it. And in that, even the tests, there are many tests that can be done for function in myositis, right? I mean, there are many, but we have chosen only the test that the IMAX has recommended as core set measures.
Okay.
And IMAX has a definition for each functional test. Like for sit to stand, they say that you have to keep 30 seconds and then you have to capture how many times the patient was able to successfully stand up in 30 seconds. But in osteoarthritis, the test is the same, sit to stand, but they are telling you should stand up 5 times. and they are calculating the time. They're looking at the time that the patient took. So they're measuring different things, right?
Okay.
So there is, so what we are trying to make an argument is, in myositis, these are the functional tests. There is
Mm-hmm.
scope for modernizing these tests, and what are the tests that are functional tests that can be modernized, and how?
Okay.
Showing the argument through other studies and other papers, how they have modernized it. Like 6-minute walk test. They've already created an app. And in 6-minute walk test, if the guidelines in IMAX says you have to walk in a straight line on a flat surface for 100 meters, come back again and do that for 6 minutes, right? And we have validated that. It's the same technique, same app can be used for myositis as well,
Okay. Yeah.
right? And then, but you should still validate in myositis. But the technique has been validated. But when it
Yeah.
comes to sit to stand, they have not done that because the technique is changing. So we are saying that here the technique has already been validated. So you do the validation for the disease. In sit to stand, the technique only has not been validated. So validate the technique as well as validate for the disease.
Okay.
So that
So,
is the goal of this paper. Like functional tests mein, what is required to do and what is being done. So even the introduction is only focused on the functional tests and improving using technology to make those better.
okay. So now, this is making me wonder all like, because the only argument that we are making in this paper is we're just going to use a software to measure these functional tests. Is modernization the word that is really appropriate? Like, what if it said computerized? Because when you say
That's
modernized,
okay. If that's if that's required, we'll change it to,
okay.
whatever makes sense.
Mm.
Again, title is fine, like that's a theme that we want to follow. If we feel like we found something better, or if we found, better way to represent the title, that's okay.
Okay. So no, that was okay. Now I understand this a little better, but yeah, I would say look for a different word. When you say
Mhm.
modernization, it could be a lot of things, right? Versus the only thing you're doing is kind of just computerizing the way all these functional tests are measured.
Hmm. Yeah, that's a point, Hasini, to think about.
Mhm.
Digitizing.
Yeah.
Yeah, that's a better
Digitizing.
word. Yeah, that's a better word.
Okay. I'd be happy with that. Software
Okay.
and mm. So, do you anything else like anything else that you think when it comes to the introduction?
Uh, no, nothing else. I was also wondering, like, are you mentioning anything about visitation costs? Because you are not expecting the patients to come to a physician. You don't have to pay consultation fees, or was that like not part of the trial, right? Are
Okay,
you guys citing this only in the context of your trial?
this
Or
is not this is just a review paper.
okay. Okay, yeah, then what about visitation costs, the consultation fees and all of those things?
That is an advantage of doing this, Hasini.
Yeah.
Like I remember when it comes to think about it this way, right? Have you used the MyChart app or the health app?
The mic up.
Not Mike.
Oh,
Like for your when you go to your doctor, they will have an app, right? EMR. It's called My Chart.
maybe. I don't.
How do you communicate with your doctor? Do you call and tell
No,
them I'm coming, or
I don't know. We just call them, make an appointment, and then go. I just call the office.
You call their office, okay. With UPMC, when you have a prescription to be refilled, right? What do you do? Like when you have to refill your prescription, you don't have to visit them, right? All the time.
I don't have any prescriptions, so I don't know.
Okay. So when I have to get any prescription refilled, I just send my chart message to the physician, and the physician approves the prescription. So I'm not going to the physician.
So you don't have to pay for like a consultancy. I think you just have to pay for the medication.
Yeah,
Mm,
yeah.
okay.
And it wouldn't have been possible, right, before.
Hmm.
So I think that's what Kushala is trying to say. So the goal of this Kushala was to figure. You remember Kushala when we wanted to do the hypertension thing, the
Mm-hmm.
app based some reminder system we wanted to make, right? And in
Yeah.
that, it was something similar to this, Hasini, where we wanted to like remind people to take their blood pressure medication. And the strategy behind that was we wanted to give people, the BP monitoring cuff. And we were hoping that, because they have the BP monitoring cuff, they're going to measure their blood pressures and they're going to be more adherent to the, medication.
Yeah.
And that is something, this is also something similar logic where we are saying that, hey, if it is easy for the patients to track their disease progression, then they'll be more adherent to the medication. And this is part of, getting them involved in that treatment,
Mhm.
right? But I would not say that should come in the introduction, right? In introduction, it should mostly be what is currently out there, what can be done better, and what are you doing? Do you want to pull up the one of the review from the other group?
Um, sorry, wait. Like which one do you?
We have two, right? Latika Gupta's group.
Sorry, let me zoom in.
Down you had in references notes, you had kept it.
Yeah. Okay, this is actually I have like so many different like note blurb sections. I need to find it.
Yep,
Yeah.
that's the one.
Yeah.
That is one.
Okay, and then I think the other one should be in here somewhere. Mm. No, this is a different one. Wait. This one is the Latika Gupta one, or they're
Hmm.
both hers. She's both
Yep,
on both of them.
yep. See, digital health and musculoskeletal care. Where are we heading? It's fine. I mean, that is a little bit, catchy, but it's here you read their introduction. Abstract is fine, not really. See, look for the structure. They're explaining about what is, how the disease affects the person and economic or whatever. And then they've told about current strategy. I think that we've addressed later. And they're telling with respect to look at this. I like this format. Think about it this way. This is a rare disease. The number of specialists who are there in myositis is small number,
Mhm.
right? So that is something you can use. Small
Mhm.
number of specialists and, blah, blah, blah. Okay, demands are high, more ratio in many countries. Okay, optimal delivery, beyond reach in most understaffed clinics. So they're mainly focused on the fact that clinics are understaffed and you need a system. Then she's talking about digital health is an option, blah, blah, blah. And that is something that there's, highlighting. We can use 1 or 2 points from here and then take it from there. But
Mm.
I would say this is one aspect. Go to the second review paper. I would rather focus on reading this introduction and
Yeah.
taking, aspects from this,
Yeah, I
right?
mean, we have like the this entire section right here.
Correct. Yes. That's how they have also structured it,
Mhm.
right? That, hey, this is one section, that's another section, and that's another section. Okay. But I
Yeah.
would say, this is fine. Can you go back to the first paper
Yeah.
and see the third paragraph? Can you go down? Integration, the emerging field broadly. Okay, that is there. Therefore, the acceptance is not always straightforward. Use of digital tools. Yeah. Okay, go down. Luckily, the revolution goes further than understanding, perhaps. Analytical methods, including combination with implementation. Okay. See, they have mentioned it.
Yeah, I think this has some good points too, because I think I forgot where, I think in the discussion I mentioned like, the development of AI and how that can be used.
Mhm. Yeah, I think that you have mentioned in discussion. Can you go
Hmm.
down more?
Yes.
Okay. Okay, I need to send you another review. I feel like the structure of this is a little bit different than what I'm used to seeing. And it goes like sections and it's a little bit confusing, right? So that's what
Yeah.
I would, state. Okay. There was this paper I really liked. It was written by a faculty at Duke, and that was so nice. It was so clear. If you
Mhm.
had to understand something, you read that, you'll understand it. And they have used simple math also to explain, hey, this is how it works. It's like someone sitting next to you and telling you how something works.
Mhm.
That is what I view review papers as. Not complicated, not unclear. See, when you say AI, right? It's like whenever people say AI, I'm like, oh, okay, they don't know what they're talking about, right? That's what I feel because even the people who are developing AI agents, you know what they have written in their paper? Most people want workflows. Don't use agent if you don't know what you're doing. That's what they've written.
Mhm.
You want a workflow, not an agent.
Yeah.
So that's the, principle, right? Anyways, that aside, go to the Stanford sit to stand paper.
Mhm.
Sit to stand. Yep. Here you see there, go down little bit. Yep. Here you see their introduction. This is what I'm more used to, right? See, very clear about what is there. Look at the references and the statements and the proof. There is no sentence that doesn't have a reference. They've not
Mhm.
wasted any words. That's how I want our writing to be.
Mhm.
And if you look at now, read the second paragraph over here.
The rapid increase in smartphone availability and recent developments in human-based pose estimation algorithms may allow automated motion analysis using two-dimensional video recorded with a smartphone. Yet, to date, studies analyzing motion from smartphone videos have been carried out in a clinical or laboratory setting. In a recent home-based study, citizen test time extracted from skeletal motion data from the Microsoft Kinect color camera and depth sensor correlated with patients' laboratory-based time. This study supports the feasibility of unsupervised at-home tests. However, research staff trained participants to conduct the test in their homes, and the requirement of owning Kinect inhibits broad adoption. It remains unclear whether pose estimation from self-recorded smartphone video can quantify movement with sufficient accuracy to predict health and physical function.
Stop. Now, this is a paragraph, right? Think about the way that they've communicated this, right? Break this down into bullet points for me.
Probably, you know,
First,
in
they've spoken about smartphone availability,
like the tech.
right? Next, what have they done? They've told that the algorithms are video based, right? And these are good. Because of video based algorithms, you are able to automate motion analysis, which is recorded on the smartphone, right? This is the information that they've given you. Now, what to do with this information? They're telling you that comes next. They are like, hey, to date, these studies, today, there are no studies that are analyzing motion from videos have been carried out only in clinics and laboratories, right? And then if one study was done which did it for patients who assessed from home, but this was done only after the patients were trained to do it. Okay. And that, but even though that was the case, it supported the feasibility of unsupervised home testing, right? Then they're talking about the other aspect, right? It is unclear whether pose estimation from self-recorded smartphone can quantify movement with sufficient accuracy. That is a very good paragraph, right? This is how we should write.
Mhm.
When we write, when it comes to our outline and, our paragraph as well, nothing is wasted. There is no repetition.
Yeah.
Can you tell one repeated point over here?
Mm, I don't think there's much repetition. I mean, there's like what, four sentences, and each one it's like building on each other, but it's not saying anything that hasn't already been said.
Exactly.
Mm.
That's how we need to write. We need to
Okay.
build on our previous point. So whenever you're writing the next point, you need to ask yourself, how am I building on my previous point?
Yeah.
Makes sense? So that is what I would say. So even when it comes to you go back to the outline and see this, again and say that, okay, how can I write in a way that it builds on the previous point? Now,
Okay.
if you take any other out part where we have written an outline, right? When you ask that question, then you will write more clearly. No repetition, build on the previous point.
Yeah.
Make sense? That's what I would want you to, take away. Next steps, I would suggest work on rewriting the introduction again, and go back to the outline and see how you can build on the other points. And then read one or two other review papers. One review paper you read apart from Latika Gupta's group, and then you see, are there any things that we have missed in our outline?
Mm-hmm.
And then that is something that you need to point out. There's something that we have missed. Okay. So main task, updating sit to stand and the 6-minute walk test outline,
Mm-hmm.
rewriting the introduction, and rewriting it based on the outline that I showed you and reviewing the sit to stand paragraphs again, like from the Stanford paper, and copying their structure
Yeah.
in or any of your writing, copy their structure.
Mhm.
Okay. So that is about it for today. Kushala, do you have any comments or any suggestions?
Yeah. No, not really, except for the ones I told.
Mhm.
Yeah, I think you found a good paper also for her.
Mhm.
So yeah,
So,
that always helps when you find a good paper to structure your paper.
yeah.
You should
And
send her
the
that
other,
Duke paper
which
also.
that is in, I don't want her to get confused. It's like, if it's not any functional test, that is in some candida.
Oh,
Right? You will
no,
waste a lot of time understanding what are they even talking about?
oh, okay. Then maybe just
Yeah.
make her read the part that you think was relevant to her and explain it to her.
Hmm. Okay, I'll do that next. There was a systematic review, like a review paper. I'd made slides on how to write a review paper.
Mm.
And I wanted to refine based on how, Hasani is drafting and then make sure that, tell based on that.
Wow.
And I'll never write a systematic review. It takes too much of time. Narrative
Right.
review is simple, you pick 10 papers and why you pick? Because that's what you found. If you find more papers, please go write. That's it. Right? So I
Okay.
would say, Hasini, I want to see if you go to the KS test or tab 7, can you go there?
Like
Yep.
which one?
Go to outline 3, I believe. Go down. Read the sit to stand.
The sit-to-stand assesses lower limb strength and endurance by measuring the time it takes for a patient to repeatedly stand from a seated position. The test is typically conducted using a chair with a standard height 43 to 46 centimeters. The patient is instructed to stand up and sit down as quickly as possible for a specified number of repetitions, e.g. 5 or 10 repetitions. The time taken to complete the repetitions is recorded as a measure of lower limb function. The sit-stand is simple to administer and can be a useful indicator of functional capacity in myositis patients. It is particularly relevant for assessing activities that require lower limb strength, such as walking, climbing stairs, and getting out of a chair.
Now, tell me, see, this is what like the state of the art model from Google has written, right?
The Gemini.
Yes. Tell me what is wrong in this?
Mm, I mean, this is more just about this kind of just telling you like, just how it's conducted. It's not really specific to myositis. It's just really general.
Hmm. It's
Like
not myositis.
no, it's just
It's
in
not for
general how it's tested.
myositis. Why do you say it's not for myositis?
Because the only part that's like you mentioned myositis, oh, it can it's a useful indicator of functional capacity in myositis patients, but like why? Like it's not saying like what about this test can give is like a useful indicator of functional capacity. I think like it
Mhm.
doesn't mention. I mean, it says assesses lower limb strength, but what about the strength? Can it show the progression of myositis?
Not only that, right? There's a bigger mistake that you have not addressed. That is, secondary.
Does it,
Mm,
do you measure fatigue also in Citosan's test?
It does a bit, but it's not very obvious.
Okay.
Look at the number.
Oh, because we're not testing or we're not having times that we're not having the amount set, we're having the time.
Yes.
Mm.
That's
This is
what I
what they,
meant by if you don't read and you don't check, and if a person reads, they will be like, what have you written? You don't know what you're talking about,
yeah.
right? But the structure, I kind of like it a little bit, it can help you a little bit with the structure, but it's still not that good. It's not
Hmm.
as good as going from our outline to the sentences, right?
Hmm.
That's what I would say.
Yeah.
And I had sent you another paper, like Google link.
Yeah.
Can you open that?
It's not like the one you saw on WhatsApp, right?
Yep.
Mhm. Mm. What is
Go to
it?
the shared folder. Go to shared with me. Hmm.
These are literally all the
Had I
same.
not shared?
No, you did. I don't know why it's not.
People. Go to people. Mm-hmm. All. Yeah, research projects. Go on top. That should be review. Yep. Go to Shiseo patent concept.
Oh yeah, this one.
Yep. Go down. Go down. More down. Yep. That's the one.
Hmm. Yeah, I saw this.
So that's how I wanted for the sit to stand.
Like this format or
Yeah, like table,
okay.
and it should be clear, and you should look at the key features and stuff. So when you do your literature review, right, you
Mhm.
need to present it this way for sit to stand or, the 6 minute walk test. What is out there? How is it different
Mhm.
and what are the different ways that you can do it? Now, let's say this I'll make you do. Let's say I want to tell sit to stand modernization, right? Then I'll talk about everything that is out there when it comes to sit to stand, right? Medieval, this is like, 5 times repetition. They're using open pose, like one technology and the same technology they're using. And smart app, they're doing remote monitoring. It has been validated. And what have they done?
Mhm.
Right? And my Pacer registry, that is our group,
Yeah.
not published yet, but it has been registered with clinical trials. That's the reason why, it came up.
Mhm.
So the based on this information, you should synthesize it and write it in 2 sentences. And
Okay.
you should take the third column and go based on that. Even if you don't write about technology, you should write about the app is there and it has been done in so and so app based, right? That's what I would say.
Okay.
And then it has been validated in, other diseases and they have these apps.
Mhm.
So there is potential to do it. That's what I would put. Make it more scientific, make it more robust. Okay. If you do the same thing for 6 minute walk test, you'll have a more clear understanding. Now, with 6 minute walk test, what do you think will be different in the table?
Mm, maybe like okay.
See, we don't want to write in depth about the technology, right?
Yeah.
So we just say technology can do this, right? That's what you're writing. But the 6 minute walk test, you need to see that is the test being done the same way
Like
or not? Like, is it the same for cardiovascular disease as well as myositis? Or are there any difference in the way that they're doing it?
Okay.
Right? And then when you say at home evaluation or in clinic evaluation, that is also different.
Mm-hmm.
So have they done studies that are doing at home evaluation? Make sense? So those are the things that you need to address in our paper. And adding more to the, robustness of our paper. So when you present, right, you can put tables and you can say that, hey, this is how, we have done. And you still didn't show me one table.
Oh my gosh. Let me write that down. I keep on, this is,
hmm I was waiting for you to show me that table so I can show you that table that I
the
had
goal
put.
list too. Like,
Okay. Got it. That's about it. So do you have any feedback? How did it go?
yeah, same feedback as yesterday. You know, I I'm glad I'm getting like the constructive criticism back so I can make the adjustments. Yeah,
hmm
good feedback. I will, I wrote a good amount of things down that I will, use to review tomorrow.